is this something that concerns you right off the bat, hearing this type of fact? And I put this out on social media. A lot of parents, whether it's Laval or on the island, were saying, yep, my kids are saying this too. They're not adhering to rules.
Well, so this is concerning. Whether you're talking about teenagers or whether you're talking about adults, people should be wearing masks when they're out in public, especially if you're going to be interacting and in close quarters with other people. And one of the situations in which that happens is on public transit. So if you're going to be on a bus with a bunch of other people, you're very likely going to be less than 2 meters apart from each other. In that circumstance, you do want to be wearing a mask, and you want to try to maintain as much of a social distance as possible. So yes, absolutely. I mean, if we want to control the spread of the virus, we, as much as possible, need to comply with the public health directives. And I guess the most important one is that distance and masks.
In that case, so I mean, how safe are buses in general? Because it's hard when there's a bunch of people crammed in, especially during the rush hours. You're saying, the physical distancing, when that's not possible, obviously they need to wear a mask, but they're not. So how great is the risk of transmission in that sort of setting, even for someone like this teenager who she herself was wearing a mask, but the others around her were not, and she's actually at risk. She has asthma. So is she in danger in that case?
I mean, I think the more people you have together in a small space, and the more that people are not wearing masks, the more potential problems you're going to have. Now, that being said, I think we can do public transportation safely. People have been using public transportation for a couple of months now, and it's been going relatively well. We haven't seen a huge upsurge in cases, but it is important for people to not become complacent. It's very important for people to continue to wear their masks, because even if the risk is low, if it's a risk that's repeated over and over again, it could lead to more cases and an uptick in the number of people who get infected. And given that we've been seeing an uptick in cases in the past few days, we need to be a little bit more careful. This is not the time for us to let our guard down and to become complacent about the public health directives.
Do you think that the uptick in cases has anything to do with this sort of public transport aspect of the school day for different children and teens?
The uptick in cases is probably due to a number of different things. The weather is getting cooler, so people are spending more time indoors. Schools have restarted, so that may be contributing to it as well. People are maybe becoming more comfortable with the virus, which unfortunately means that they're relaxing a lot more, which is suboptimal. So there's probably a number of different factors playing into it, but it just underscores how important it is for us to stay the course and to not let down our guard and relax too much.
You were talking about, doing public transport safely, and it's something you said we did see in the last couple of months, but do we know enough about let's say, the ventilation and how safe it might be to be riding a bus?
So it's hard to say. I mean, whenever you have a bunch of people together in a small space, good ventilation certainly helps, but it doesn't negate the risk at all. You can open the windows in a bus, which of course helps, although that's going to become less feasible with winter, as winter approaches. So there's probably, you can mitigate the risk a lot. People always ask, is something like this safe or dangerous? And that's a bit of a false dichotomy, because nothing is completely safe and nothing is completely dangerous. It's really a question of, can we lower the risk and can we mitigate that risk? So if you want to make riding on a bus as safe as possible, the best way to do that is to wear a mask and make sure everybody else on that bus is wearing a mask, and try to spread yourself out as much as possible. Again, easier said than done, and maybe the realities of the situation will make that difficult, but the one thing you can do, the one thing you do have complete control over, is whether you're wearing a mask, which I think is pretty clearly something that has been shown to help, and something that I hope everybody is going to continue to do going forward.
And that's the thing, though, control, right? I mean, you can control what you do, but you can't really control what others do, even though it's a mandatory, it's a rule on the STM, and in public places in Quebec, we're still seeing there's a 1% population that's not wearing the mask on the bus, and the STM told me that themselves. So what can somebody who's doing all they can for themselves do when they're in that situation? I guess in a medical sense?
Well, I think the only thing you can do is, and again, try to keep your distance as much as possible. The further you are away from somebody, the less likely it is that the virus is going to pass from them to you. So if you have the power to do so, try to use public transportation in off hours. It means that the trains and the buses are going to be less crowded, so you can keep your distance. If you see that one car is particularly crowded, maybe move to another one. And if you see that somebody is not wearing a mask and they refuse to put it on, maybe keep your distance from that person. Maybe the further you are from that person, the less likely it is that the virus will be able to pass from them onto you.
Just lastly, the idea of, inside the schools, the kids are kept in their bubbles, their classroom. Those are the people they stay with all day. But what happens? Does that break as soon as they get onto public transport, especially those who are not complying, not adhering to the rules? What happens in that case? And are the bubbles even working?
The problem with the bubbles, as we're doing them in the schools, is that the children eventually go home. And when they go home, they by definition come out of that bubble. So it's not like with the sports teams where the players were tested coming in, they were put in their isolated bubble, and they don't leave. Children, of course, have to go home. When they go home, they interact with their families and they interact with other people. So the bubbles are not total. Their purpose is to some degree, try to limit the number of interactions between students so that if there is one student that tests positive, if you're able to keep the classes separate, you know that you at least contain the viral spread to within that one class, and you only have to test, in theory, the students in that one class. So it's really more about limiting propagation of the virus. If it were to get into the school, it doesn't prevent the virus from getting into the schools in the first place, because these are not complete self-isolation procedures. They are partial isolation procedures that exist only within the hours when the students are in school.
Is there anything else parents or even teachers, anybody within the school network should know at least about what's happening from the transfer from school to home in that process?
I think just try to be as careful as possible. Wear a mask, keep your distance, wash your hands. Those are the most important things. If we all do that, we largely limit the spread of the virus and we make everything just a little bit safer.
Thanks so much, Dr. Labos. I appreciate it.
My pleasure. Take care.